So, osteogenesis imperfecta, also known as the brittle bone disease. So, this is the condition that, most importantly, it varies. What we don't know is how severe is the condition. So it varies from persons who can pretty much walk and function and end up just having with a lot of broken bones, but surprisingly, they might as well heal not too badly, right? So, but and quite quickly, but then break again. So it just, this is a bit odd in that sense because they really crack, just crack, and so that's one side of the spectrum. And then, of course, you have the much more severe conditions which are preventing the development, you know, altogether, making that development go into a different, into a difficult path. So this, in that scenario, we don't know. But let's try to produce a more or less universal answer. So the universal answer is going to be, first, there are two things to consider. One is that what we know is that this is the condition that in first place and the most affects the bones. Two, that it's a genetic condition. So with the genetic condition, we have a basic approach. Can we change the genetics? No, we can't. However, genetics is like a factory producing the particular quality of the materials out of which the body then builds something. And putting it in a very simple way, if we have the and the wall, then there could be bricks and there is mortar that connects the bricks. What is the logic? If the bricks that you get, they are of not so good quality, and of course they're bricks of different types, right? They're bricks for the muscles, they're bricks for the collagen, they're bricks for the bones, and so on. So, but if the particular bricks that a child gets in the genetic lottery are not that great, so what is our main opportunity? Well, our main opportunity is the surrounding mortar, right? So it's the cement rather than the brick. So you see, and then of course, in a standard situation, the faulty bricks, they kind of affect the cement. So it also typically, and that's the problem, because in a healthy body, those things are kind of feeding each other. Better bricks get better cement helps better bricks. So once one element disappears, then you unfortunately have the very limited compensation. So the things have a tendency to spiral and get gradually worse on both counts. But on the other hand, the cement, even if it's affected by the faulty bricks, genetically, it's fine. And on the other hand, it's also the cement, this mortar, that's the simplest thing that exists in the body, the least differentiated, so therefore the most universal, ubiquitous, and so on. And that's what we want to stimulate, right? So you see, this is our entry into all of the genetic conditions that, fortunately, the whole thing about fascia and so on is that this is their primary cement that we can use to either insulate their faulty bricks or hopefully to go even further and kind of maybe even replace certain architectural compositions in such a way that the cement will take over for the missing or faulty bricks. Right, and this example that you can visualize is that if you compare, let's say, the more modern brickwork, which is nice, rectangular, and organized with just very thin layer of cement in between, if you compare it with some kind of rustic old wall, which would be just odd kind of boulders and stones taken from just around the area, and they would still be connected into the wall, not because of their perfect shape, or the perfect fit with each other, but because you just use more cement to put them together and to get those balls. So that's really the big logic. Now, what does it mean on the practical level? On the practical level, it means that you want to get the impact that is going to start helping not the bone itself in first place, but the elements which are surrounding it, right? So you see, and in that sense, it starts with the transitions, particularly at the joint levels, because the joint capsules and the periosteum of the bone are continuous. So that's our first opportunity. What happens around the capsules, how they could be, how they could help this, if you look at the whole thing, if the bone would be a tube, so the capsules would be more like these donuts which are put in between them. So that's this connection, capsules influencing the bones. The second thing that we have as the opportunity is, of course, the connection which go through the ligaments, muscles, and so on, because that what happens. On top of it, if the bones are not holding well, you also end up with a certain loss of the, you know, elasticity of the tendons, respectively ligaments, and so on. And those are the ones which would be affected by the like mini damages, right? Because there are big damages which are happening to the wall, and the mini damages which are then could really blend and confuse their separate workings of the individual ligaments, tendons, and so on. So that's another opportunity that we have, kind of the number two. Right, so you see the number three opportunity is really the big one, because if you look at the total system, well, what's the commonality for everything? That's the common skin and the mechanical fat that goes, which is basically being the other side. So that's the external facet, and historically that in evolution you have the so-called endoskeleton and the exoskeleton, right? So, for example, the insects and so on, they have the exoskeleton, and they don't have the endoskeleton. They don't have the bones per se. So this is just an indication for you that the two are related, depending on how the things work. So if you have a relatively weaker or more brittle bones, that means that this skin plus mechanical fat component could to a certain extent be activated to help to cushion, protect, and actually like minimize the loads that go towards the bones as such. So that's the number three. So number four, so since their bones which are easily breakable are not only in the extremities but also within the rib cage as well, so that often affects the way how the child performs the respiration. So therefore, the respiratory mechanism, which is supposed to keep everything, all the soft tissues that we spoke about, in a good tone, so kind of keep stimulating and making this kind of keeping the mortar and the cement pliable and moist, unfortunately, then even the mechanics of the respiration itself could be quite significantly affected by these micro damages, and also by the poor elasticity of the connectors between the bones as well. So that's the fourth component, right? So you see, these are the most obvious things which are always coming in that. But then, of course, there is also number five. So that will be the extremities. So typically, what is being affected are those kind of thin, long bones, because they're just easier to break. They're more exposed to it. And these are the scary pictures that you would see on the internet. That would be, the x-rays and so on. They would be still more related to those, to the long bones. But then we get back to this basic idea that we always discuss, that, okay, if we look at the extremities, say the hand, the arm, or the leg, so there are one humerus, then there are two bones of the forearm, so like three long bones, and then you have a good bunch, like 27 smaller bones, which are in the hand, and it's the same situation for the foot. So again, this is where the bones are playing maybe less a role for being like specifically exposed to loads, because the tendons are playing greater role. So the logic again is if we can activate those and get better help from the kind of this deep membranes of the foot and the hand, that gives us an additional opportunity in helping potentially also reducing the load, the unfavorable load distributions on the long bones, and that's another help that we can get. So these 5 avenues are the ones that always have the potential to work and improve the condition of the person with this osteogenesis imperfecta. But of course, the nuances further depend on the how severe is the condition, how old is the person, and so on. But the general narrative to begin with would be going along these 5 lines.